Step one in any procedure is to do a thorough consultation with your client. We want to rule out any contraindications, see if there's any precautions, and then most importantly, find out what the client is really looking to achieve from the procedure. So share with me a little bit about what you are hoping to get from the procedure as far as how your lips will look at the end of the service.
I want my lips to have the same shape that I have now.
Okay.
I just want to even out, I have a scar, so I would want to even that out.
Okay.
And I'm going for a brighter color.
Okay, and when you say brighter, do you mean brighter pink, brighter?
Brighter, like a mixture of red and a little bit of pink.
Okay, so kind of a rose color. So looking at your lips, you do have a beautiful natural shape. There is a little bit of a blue undertone to your lips, so we will counteract that with a little bit of orange in your lip color formulation. However, don't be concerned, it will come out a beautiful rose shape. How long have you had this scar here?
Since I was like 10.
So it's an older scar.
Yes.
Okay, great. We'll work as much as we can with it, but just keep in mind scar tissue is a little bit different. And what we'll do is make it as even as we possibly can. Sound good?
Sounds good. Thank you.
Thank you for filling out the consultation form. This really helps us to make sure you get the best possible results and the safest procedure. I noticed that you marked down you've never had a cold sore. Is that correct?
That's correct.
Wonderful. And that's really important because if our client did have the tendency to cold sores, we would have to have her on a medication prophylactically. I don't see any other concerns here. We discussed the area of treatment, so we can go ahead and fill that in with what your desires are. The second sheet, of course, is discussing topical anesthetic use, and you've had no allergies to any lidocaine or anything like that in the past.
I have.
No problems at the dentist?
No.
Okay, wonderful, great. And then with the informed consent, we did give you the option to have a patch test. Of course, that would require waiting 24 to 48 hours. So you have waived the patch test and feel comfortable with that. And that's great. And you do understand that this is not a science, it's an art. And we are going to give you the best possible results we can with your lips. Now, as far as photo consent, you are okay for us to use your photographs?
Yes.
Okay, wonderful. And if your client did have any concerns about photographs, if they perchance just wanted it to be just their lips, or if we're doing brows, you know, whatever area it is, that's fine. We can document that, but we always have to have before and after photographs. That's a must. Now, in Minnesota, we have to have a standard tattoo release form, and our client has filled that out. And then the last thing is that we always do want to make sure that we have a copy of our client's driver's license, because they do need to be 18 years or older in Minnesota, and we need to be able to prove that, as well as the artist level consent. We want to make sure that our client understands the level of artist. We'll always ensure that they leave looking good. We're not going to let anybody go out looking, you know, lopsided. However, there is a difference between a student level, obviously, and a master level. So this looks great. You've signed and dated everything. Any questions for me?
No, not at the moment.
Wonderful. Then we can go ahead and begin the procedure. Now we're going to show you a proper tray setup for the procedure. It's important that you have all of the tools that you need on your tray. This tray has been sanitized and has a drape on it, as well as a waste receptacle on the side that you can use. We have our individual tools for designing the brow, as well as we also have our tools for doing the actual procedure. So what you're going to see here to design is a red pen. We'll be doing shaping the lip first. And then we also have two lip colors that we have chosen, and we'll be mixing those together into our pigment cup, which has been put onto a cotton round with a bit of Vaseline. This is handy because now you can move this over toward your client, move it around, and you don't have to worry about it spilling out as you would with a pigment ring. And especially when you are a newer artist, it can be a little hard to have that very liquid, organic sort of a pigment in a ring. I do have my numbing agent here, as well as I have applicators for that. You are going to see that we draped our, or wrapped our machine, and we have our clip cord sealed with some athletic wrap, as well as the power source is covered. Over on this area here, there is some Vaseline that we'll use during the procedure. And then coming over to what I call the wet side, we have some wipes. We have a set of gloves to start out with, although you will usually be using more than one set of gloves. And remember, if you do need to get additional items, you always have to remove your gloves and put new gloves on. I have saline wrapped and covered, including the bottom, and that is for washing the eyes as we're working, if we're doing liner. And for lips, we're going to use it for wiping. That way we don't always have to be using the green soap, which can get a little bit of irritation if used too often. This is our green soap, which is wonderful at the end of a procedure to really clean the skin. And in lip services, particularly, we are using organic pigment, which stains the skin a bit more, so that will be very helpful. Your cotton rounds can be used for multiple things, so make sure that you have enough of those out. And then again, I do have some Q-tips and I have some microfibers, and these will be used throughout the procedure. Be sure to discard your cotton rounds and your wipes as you use them in your waste receptacle. And before you start actually doing the procedure with the machine where you're going to open the skin, you will remove anything that is not going to be used at that time. So pigment must be removed, your pen will be removed, your numbing agent will be removed as well. Now you'll notice there are 2 cartridges, and we have not opened them yet. We'll open them right before the procedure. And we have 2 different choices, one for lining as well as one for filling in the lips. Now at the end of the procedure, this bag can just be turned inside out with anything else that is left on there. Remember, if it's on the tray, it has to be disposed of, even if it has not been used. That all can go into your waste receptacle, which then can be sealed and disposed of properly. We're going to go ahead and design the lip. We'll be using a red pen specifically for this purpose. And we will be putting points on the lips and then drawing straight lines. We want to put our points in the center, which will be about 30% of the lip design. And the idea is to have symmetrical lips. As well, the Cupid's bow is very important, so we'll be marking the high points of that on each side to make sure that they match side to side. So you can see our master artist now going ahead, and she put in her center line and now is beginning to mark the points. It's much easier to design when you have those guideposts in first and then initially drawing straight lines versus trying to just design the lip free-handed. We'll do the outline first, and then we will fill the entire lip in. These points will also be very helpful when we're working with lips that are more asymmetrical, or where the client would like a little bit of correction in the actual lip shape. One thing we will not be doing is designing outside of the lip vermilion. So you're going to see Kay making sure that that design stays in that lip vermilion area and doesn't move on to surrounding skin. And then once we have our straight lines, we can go ahead and round the edges slightly within. And also please note that we don't draw all the way into the corner. The corners should look like V's when the mouth is closed. We don't want it to look like our client has lipstick running out the edges. And just a tip with these pens, these are the pens that you have in your kit. It works better if you're not pressing too hard on the pen. Just let that pen glide over the lip. And you'll see she's beginning to fill in that center area, which again will be about 30% of the lip. And now in classic art, you'll see that the lower lip is always going to be slightly larger than the upper lip, and so we will design that way.
Smile.
Smiling will pull the skin taut so that you can color it in a little bit easier, but it also helps you to see the line that you've just placed.
Yeah, smile for me.
You can always use a Q-tip if you've gone a little bit outside of where you wanted to draw your line. It is important that that line be sharp because this will be your guideline when you're putting in the lip outline. And you can see how there's a nice triangle where the upper and lower meet.
Smile.
If your pen seems like it's not putting ink down well enough, just wipe it on a piece of paper once or twice and then that'll get it going again. Even our lips have some dead skin cells and our lip pencil can pick that up. Now, the reason that we design with straight lines is that it is much easier to create symmetry. If we start that way, we can go in and curve the line within the straight lines much easier and have both sides of the lip match as well as the upper and lower. Another very important thing to remember is that the sides of the lip, where the upper and lower meet, that should be a triangle, a nice, neat, straight triangle. We don't want to have the upper lip curving down into the lower lip and the lower lip curving up too much. It's an unnatural look. So a straight line into the corner on both the upper and the lower is going to be much more aesthetically pleasing. We'll now finalize the design. We're going to have our client smile so we can see how the edges come together. We need to make sure there are no ripples in our line. Remember, this is the design that you're going to follow when you are lining the lips. So take your time. It's the most important part of this service, getting your design in place, having it smooth, having it symmetrical. Once that is done, we can apply our numbing agent, and you can see that we have some of the number on the back of the glove. We're going to apply that to the lip line area and then to the lower lip, as we only work one lip at a time. Now, this is just one method of numbing. There are different ways that you can do it, and of course in class you'll see additional ways and additional products to use. This particular number will not require any cellophane over the top of it. And we can numb the lip line at the same time as we're numbing the lower lip. With lip procedures, we do want to have the client comfortable. We don't want to apply secondary number during the procedure if at all possible, so the pre-numb is an important step. If you are worried about losing your line, you can always put a little white pencil around the outside. But otherwise, if you roll the cotton, you should be good. Now you can see that our numbing agent has been applied. We're going to set our timer for 20 minutes. Let our client relax and get numb, and in the meantime, we'll mix our pigment and get our tray ready.
Okay.